Botox, right. It's not just for smoothing foreheads anymore, apparently. You've been, like, really digging into bruxism treatments and stumble across this whole Botox thing.
Yeah, it's pretty interesting when you think about it. I mean, it's estimated that almost 80% of adults grind their teeth at some point, and a lot of people have no clue they're even doing it.
Like, way more common than you'd expect.
Definitely. And we always hear about the jaw pain, but bruxism can actually lead to some pretty serious stuff like damage to your teeth, headaches, even a potential link to sleep apnea.
Wow, okay. So not just an annoying clicking sound anymore.
Not at all.
You've already tried a few different treatments, which is awesome. You're ahead of the game. But before we get into the why of Botox for teeth grinding, let's break down how Botox, you know, the wrinkle buster, can actually help with a medical condition like bruxism.
Well, at its core, it's all about this really targeted relaxation. Botox is actually a neurotoxin.
Okay, now hold on. That sounds kind of scary.
Right, but it's not as intense as it sounds. Basically, it just blocks those chemical signals that go from your nerves to your muscles. So it causes temporary paralysis, but in a super controlled way in a very specific area.
So it's like precise muscle whispering, not a total shutdown.
Exactly. When it comes to bruxism, doctors target the masseter muscle. That's the big one responsible for chewing.
Ah, okay.
By injecting Botox into that muscle, it kind of chills it out a bit, reducing its ability to clench and grind.
So I'm hearing no more teeth gritting soundtrack at night, but I can still enjoy my morning coffee.
You got it. You can still chew, talk all the important stuff totally normally. Think of it as easing that clenching intensity, not like freezing your jaw completely.
Okay, that makes me feel a lot better. But how long does this relief even last? Asking for a friend, obviously.
Yeah, so typically the effects of Botox for bruxism last about 6 months or so, but of course everyone's different. One important thing to remember is that the research on long-term effects of using Botox for bruxism repeatedly is still kind of up in the air. So that's definitely something you'd want to chat about with your doctor.
That makes a lot of sense. So we've talked about how Botox works on the muscles, but in your research, you also found that it can be used for TMJ issues.
Absolutely, and this is where understanding the root of your bruxism is really, really important.
Okay, so we're talking TMJ, like problems with the actual jaw joint. Is Botox like a magic reset button for that too?
Well, it can be a big help for some people, but it's not exactly magic, unfortunately. Sometimes TMJ problems happen because the muscles around the joint are working way too hard and putting a ton of strain on it.
Makes sense.
So Botox can step in and relax those specific muscles, right? Which gives the joint a much-needed break, and that can help reduce pain and inflammation.
So it's like a chill out session, whether it's the clenching itself or those overworked muscles messing with the TMJ.
You got it. But here's the thing. Before you even think about Botox, a doctor really needs to figure out if the TMJ is actually contributing to your specific bruxism or if it's a totally separate issue altogether.
Right, because it's not always like a simple answer, is it? But hold on, we've been talking about Botox as if it's like the only option. But you also found info on other treatments for bruxism.
Right. Oh, absolutely. You're right to do your research and explore all the options.
So what's the deal with those other treatments and how do they stack up against Botox?
Well, mouth guards are often the first line of defense. They basically create a barrier between your teeth so you don't do as much damage when you're grinding, especially at night.
Like little mouth helmets. I've seen those.
Exactly. But, and you probably saw this coming,
Uh-huh. There's always a but.
they only really address the symptom, the grinding itself, not the underlying cause. And some people find them uncomfortable or, say they mess with their sleep. Plus, they don't actually stop the clenching force. They just kind of cushion the impact.
So not exactly a peaceful solution for everyone.
Mhm.
What else did your research uncover?
Well, you also came across biofeedback.
Oh, yeah, that was interesting.
Right. It's pretty cool, actually. It uses sensors and these gentle alerts to train you to become aware of when you're clenching or grinding, like in real time. The goal is to learn to consciously relax those jaw muscles.
So it's like mindfulness, but for your jaw.
Exactly.
Okay, that's pretty neat. So it seems like each approach has like its own pros and cons.
Yeah, for sure. And with Botox specifically, there are potential side effects to keep in mind. It's generally considered safe, but you still got to be aware.
Right, of course. We can't just gloss over those. This is still a medical procedure after all. So what are the potential downsides, even if they are, like, super rare?
Sure. So some of the more common side effects with Botox for bruxism are things like temporary headaches or maybe a little swelling or itching around the injection site. Nothing too crazy.
Okay, that doesn't sound too bad.
Right. And in really, really rare cases, there's a small risk of more serious side effects. But I'm talking extremely uncommon, especially if you're working with a qualified professional, which you always should.
Absolutely. Got to do your research. And speaking of being informed, you mentioned in your research that Botox for bruxism is considered off-label use.
Yeah, good catch.
So what does off-label even mean, and why should our listener care about that?
Okay, off-label, it sounds kind of secretive, like we're talking about some like hidden menu at a restaurant.
Yeah, it's not quite as exciting as that,
Yeah.
unfortunately. Off-label really just means that the FDA has approved Botox for certain uses, like those wrinkles we talked about. But treating bruxism specifically isn't, like, officially on the list yet.
So it's not that it's like bad or anything. Not at all. It just means the research on how well it works for this specific thing is still going strong.
Got it, okay.
And honestly, this is where that open communication with your doctor is so, so crucial. They're going to be up to date on all the latest research, and they can talk to you about the potential risks and benefits based on your specific situation. Plus, they'll make sure you're giving informed consent for the treatment, which is super important.
Informed consent, yes, because you got to know what you're getting into, right? Okay, so as we're, like, resurfacing from this deep dive into Botox and bruxism, what would you say is the main takeaway for our listeners today?
Well, first off, you've been incredibly thorough with your research, and I love that you're asking all the right questions. But it's important to remember that Botox for bruxism isn't, a one-size-fits-all kind of solution. It's potentially a piece of the puzzle, right? So now, armed with all this knowledge, go have a good conversation with your doctor. They can help you decide if it's the right fit for you.
Yes, talk to your doc, take this information, and make the choice that feels right for you. And hey, maybe while that Botox is, like, potentially giving you a break from all the clenching and grinding, you can use that time to explore those root causes we were talking about, right?
Exactly. Addressing any stress or anxiety, maybe even some lifestyle factors that could be contributing to your bruxism in the first place.
Right, like hitting the pause button on the symptoms so you can really tackle the source. It's huge. And on that note, we've reached the end of our deep dive. But this is really just the beginning of your journey towards a happier, healthier jaw. So until next time, keep exploring, keep asking questions, and keep diving deep into the things that matter to you.